Overview of malaria. Malaria is a life-threatening disease caused by parasites transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable but remains a significant health challenge in many tropical and subtropical regions. A history of malaria. The history of malaria stretches back thousands of years, with evidence of the disease found in ancient Egyptian and Greek texts. It has influenced major historical events and societal structures, such as the colonization patterns in Africa and the American South. Malaria's impact led to the development of various treatments and control measures over centuries, reflecting a significant battle between humans and disease. B. Discovery of malaria parasite. Malaria was first discovered by French Army Dr. Charles Louis Alphonse Laveran in 1880. He observed parasites in a sample of human blood, a discovery that proved malaria was caused by a parasitic infection. This finding was a crucial turning point in understanding and treating the disease. See symptoms and diagnosis. The symptoms of malaria include fever, headache, chills, and vomiting, appearing 10 to 15 days after the infective mosquito bite. Early diagnosis and treatment reduce disease severity and prevent deaths. Rapid diagnostic tests and microscopic examination of blood slides are the common methods for malaria diagnosis. D. Investigations. To diagnose malaria, blood tests are employed to detect the presence of the parasite. The most common tests include: 1. Rapid diagnostic test, RDT, provides results within 15 to 30 minutes. 2. Microscopic examination, gold standard for malaria diagnosis, involves viewing a stained blood smear under a microscope. 3. PCR, polymerase chain reaction, used for precise parasite detection and species identification, especially in cases of low parasite density. E. Global impact. Malaria causes hundreds of thousands of deaths annually, mainly in sub-Saharan Africa. Children under 5 are the most vulnerable group affected, accounting for about 2/3 of all malaria deaths worldwide. F. Prevention and control. Preventive measures include mosquito control through the use of insecticide-treated mosquito nets, indoor residual spraying with insecticides, and anti-malarial drugs. These strategies have significantly reduced malaria rates globally but require ongoing investment and public health strategies to sustain gains. G. Treatment, allopathic approaches. The primary treatment for malaria involves anti-malarial medications, which vary depending on the type and severity of the disease. Commonly used anti-malarials include: 1. Artemisinin-based combination therapies, ACTs, the most effective treatment for P. falciparum malaria. 2. Chloroquine, used for P. vivax, P. ovale, and P. malariae infections. 3. Atovaquone proguanil, quinine, and doxycycline, used in areas where resistance to chloroquine is high. Treatment also involves supportive care such as rehydration and fever management. H. Fun facts about malaria. 1. Malaria was once a significant health problem in the US and Europe, eradicated only in the mid-20th century. 2. The name malaria originates from the Italian mala aria, meaning bad air, reflecting the old belief that the disease was caused by bad swamp air. 3. The deadliest malaria parasite, Plasmodium falciparum, is responsible for most malaria-related deaths worldwide. 4. Gin and tonic was initially developed in colonial India, where British troops took quinine, an effective anti-malarial compound, mixed with gin to mask its bitter taste. Recent advances. Recent advances in malaria research include the development of gene-drive technology to genetically modify mosquitoes, rendering them malaria-free. Another breakthrough is the RTS/S01, Mosquirix trademark, vaccine, which shows partial protection against malaria in children. Conclusion: eradication efforts. Despite ongoing challenges, global health initiatives aim to eradicate malaria by 2040 through integrated strategies involving improved surveillance, increased funding, innovative research, and community education. These efforts, if successful, could save millions of lives and enhance economic development in affected regions.